Good day, everyone. We are from Group 2, and this is our caricature. The first caricature is entitled
Healthcare Disparity.
Hi, everyone. We are from Group 2, and this is our caricature. The first caricature is entitled
Healthcare Disparity. Money talks, lives are muted.
and the second caricature is entitled
Fake generosity, followers for favors.
Hello everyone, my name is Sayana Kegisaki. In this caricature, it shows the hospital setting that some of the patients might experience this kind of scenario that some healthcare professionals are prioritizing those people who are having much money than those who hasn't. The second caricature, it shares the reality that nowadays giving help to people must be seen by everyone. By some people, the pureness of giving help is not that vivid anymore like before.
Hi, everyone. I am Princess Kian Argolay. So the first caricature is entitled Healthcare Disparity, Money Works, Lives Are Muted. In this caricature, it is divided into two. One side is a well-lit healthcare facilities welcome those with ample financial sources. On the other side, it symbolizes the healthcare reality for those with limited financial means. The contrast vividly illustrates the disparities in healthcare access based on financial status. The second caricature, invention of vlogger in a spotlight, seemingly extending a helping hand to someone in need. However, upon closer inspection, the vlogger's hand is revealed to be a manipulative operator's trick, highlighting the emotional toll of being used as a prop in the vlogger's pursuit of fame.
I'm Grace Judy Gamutan. The first caricature shows a person holding a big dollar sign, illustrating how money often decides who gets health care, while others silently struggle. The caricature emphasizes that health inequality is unjust and everyone should have equal access to health care. The caricature of people in line, some with money bags and often with nothing, highlights the gap in access. My message urged breaking barriers, amplifying the voices of the unheard, and working together to ensure healthcare is available to all, regardless of financial status. The second caricature, this caricature illustrates how some vloggers pretend to be kind on camera, but they are actually just trying to get more followers and likes. They do nice things in public to get more attention, but they don't really care about helping others. It's a reminder that real kindness comes from caring about others, not just wanting to be popular online. So it's important to be genuine and sincere in our actions rather than just seeking fame and approval.
Hello everyone, I am Adrian de Guzman and the first caricature is all about inequality. The person who have a lot of money have received preferential privilege while the other people who don't have a lot of money have to wait in line to get treated So the second caricature is all about a young, malnourished child who is asking strangers for money to buy food because he is too hungry and his family is poor, while the guy is giving him money, but he is also filming it to post it on social media to gain popularity.
I'm Clyde Maris M. Elebido. I'm going to share my opinion about our first caricature entitled Healthcare Disparity, Money Talks, Lives Are Muted. It shows that someone is depicted as overly generous and sharing their acts on social media to gain popularity, while generosity is typically valued. The portrayal raises questions about authenticity. Posting acts of kindness on social media for personal gain can be seen as insincere. Prioritizing attention over genuinely helping. True generosity comes from a sincere desire to help rather than seeking validation online. Therefore, while exaggerated, the caricature reflects a realistic critique of superficial behavior in the age of social media. So, in the second picture, or rather the second caricature entitled Fake Generosity, Fake Followers for Favor, as it's shown in the picture, the doctor is shown favoring a rich patient over poor ones. At it shows the doctor's unfairness in that situation, the rich patient handling a money in order to get first treatment than those who needs more care but not get treated because they lack of financial needs. This shows how some people get better treatment just because they have more money. It's a reminder of how unfair healthcare can be, with wealth deciding who gets help and who doesn't, instead of everyone getting the same care they need.
Hi everyone, my name is Siobhan Ives Himo. Healthcare prioritizes wealth over medical needs, posing ethical dilemmas as it goes against equity and justice principles, as it favors financially privileged individuals over economically disadvantaged ones. The first caricature, there's a patient who has paper money is taken care of first, while the other one who has only coins is waiting in line. In other words, patients who are wealthy are more likely to receive timely and comprehensive medical care, while those who are poor often face barriers such as long wait times, limited treatment options, and substandard facilities. Also, as they prioritize patients with money, it perpetuates social inequalities that will widen the wealth gap and reinforce the belief that financial status determines patient worth. So, it is essential for healthcare systems to prioritize patients based on medical needs rather than financial status to ensure equitable access to quality care for all individuals regardless of their socio-economic backgrounds. Social media has seen a rise in cloud chasers who exploit vulnerable individuals or situations for personal gain, prioritizing followers over authenticity, often resulting to sensationalism or manipulation to achieve the desired online influence. For the second caricature, is one such example when there is a poor boy begging for money and there's an influencer make use of the other poor boy's situation to gain popularity by giving him money. Instead of addressing the root causes of the child's situation, he just do it solely for the purpose of creating content that will generate views, followers, and likes to achieve fame and recognition. This kind of act demonstrates a lack of empathy, respect, and understanding the complexities of poverty and social inequality.
Hello, my name is Rory Big. I think everybody now is well aware of the nature of Filipinos and, well, just human nature and the way the poor and the wealthy interact. Because, to be honest, it's not really fair and or, well, economical for those who are less financially inclined. Like, rich people can get what they want in a time frame that they wanted, just simply because they have the funds to do so. While poorer people make daily wages, just enough for them to live by and survive. What I see in our first piece is the fact that by financial and social bias is still a prevalent human nature. By that, it's not it's not a pandemic. It's not something like that. It's just present, and low-key we've normalized it, and that's not at all good. Like, especially here in the Philippines, you just say, ay, kaya naman na siya, dato na siya. Like, it's not it. I mean, everyone should have a chance, no matter how financially wealthy they are. The second one is, like, just straight up deplorable behavior. Like, imagine using your fellow human for, I don't know, fame, sympathy, views, clout chasing. Like, in the end, who is the one who needs who? Like, if you need the poor person to, like, get views, is it the problem you and not them? You're just pretending to give them what you essentially gotten from other people's sympathy, like clout chasing and manipulation of others. Like, bro, that's not a proper way to fucking help them. If you really want to help them, just give the money to them without filming or anything, without even telling anyone. You just do it for self-gratification. These cloud chasers, man, they're worse than the social biases. Because I mean, it's not everywhere social biases are present, but these scumbags, the cloud chasing ones, the manipulating ones, they are a special breed of bad.
Hi, my name is Cameron Diaz. Healthcare disparity, lives are muted. This is a reference to significant variations in treatment results, general health, and healthcare services among various populations. A number of variables, including socioeconomic level, race, ethnicity, geography, and education, can have an impact on disparities. Money talks, makes the argument that a person's ability to pay for healthcare has a significant impact on the type of quality of care they can receive. Richer people may frequently afford health insurance, pay for medical procedures, and receive healthcare service without experiencing several financial hardships. This statement also suggests that people with low incomes and can have their own opinions and concerns about healthcare requirements silenced or neglected. The word muted implies that people may have difficulties because of lack of funds speaking up for their health, getting prompt and appropriate medical care, and experiencing favorable health outcomes. The phrase emphasizes how inequities in healthcare are caused by systemic problems with those systems. In comparison to their richer counterparts, those with lower socioeconomic status may encounter obstacles such as restricted access to prevent care, delayed diagnosis and treatment, and generally worse healthcare outcomes. Reducing healthcare disparities frequently entails addressing structural problems, pushing for legislative reforms, and supporting programs that guarantee everyone, regardless of income level, equitable access to high-quality treatment. Fake generosity, followers for favors. The act of kindness, giving, are not selfless. Rather, they are carried out with a secret purpose or underlying objective. The main goal of the apparently humanitarian deeds is to gain more followers on social media. The goal of seeming kind or giving is for people or organizations to gain more supporters. As their followers grows, they might use it as a platform to solicit favors like product endorsement, charitable donations, or other cooperative endeavors. When followers come across such seemingly giving deeds, they must alert and skeptical. Users can choose wisely who to follow and to support in the online community by being aware of the motivations behind these activities. Sincere involvement and tend to more meaningful and lasting connections between content creators and their audience. This strategy is frequently linked to influencers, companies, or people who want to rapidly increase their online visibility. Instead of acting generously, they can give away foods, host competitions, or donate to charitable causes in an effort to attract more active and vocal followers.